And to carry this further, I thought today we should answer some of the common questions about disc issues. So this could be a disc prolapse, extrusion, protrusion, etc. There might be a bit of a repeat from the last live, but I just thought it was important to include it, so I'm doing that. So the first question, the common question is, what are the causes of a disc prolapse or any disc issues? So as we had covered the last time, it could be a part of the aging or degenerative process of the body where the disc dries up, the outer part of the disc dries up and the inner jelly comes out and starts to give symptoms in the spine. The second factor can be genetics, though it is not a very big factor. It is not necessary that if your parents had a disc issue, then you will also have one. But yes, it does play a role. Another would be obesity. So if you are obese, obviously there's more weight coming on your spine. So that will lead to earlier degeneration. Okay. Another will be okay, I'm just looking at my notes here. If you are hyper flexible and you tend to overuse your spine, overstretch your ligaments and joints, but this is not something that is found in the common population. Usually, this will be somebody who is a gymnast or, say, a ballerina, or somebody who's into sports or activities that need a lot of flexibility. However, these are not so common. A very common factor that contributes to disc issues apart from degeneration and aging is trauma. So this could be a simple fall that can cause a disc issue, or it could be a sports injury like rugby or any other team sports where there can be a lot of contact, and people can slam into you at a very high velocity or speed. So that can be another thing. Or say car accidents where you have something like a whiplash injury. You can even have a disc injury, right? So yeah, these are the common causes of disc issue. When I say disc issue, it could be prolapse, extrusion, protrusion, so the whole thing. And we're talking about, even if I say back, we're talking about the disc in general throughout the spine. Okay, another question I get asked is, what do I do? I have a disc issue. So there's no need to panic. There's always a solution. So the first thing you need to do is go to your doctor, get some medication, especially if your pain is quite severe or you are in that acute stage and a hot pack, cold pack, etc. doesn't work very well for you. So the doctor will give you pain medication like muscle relaxants, nerve relaxants if you have any nervy symptoms like pain down the arms and legs. They can even give you steroids. That's very low dose steroids. So they can even give you steroids for if you have a lot of swelling in the area around the disc or the spine. So there's always a time and place for medication. I'm not very pro medicine, but then yes, there are sometimes you need to help your body with these medications. Apart from that, from physiotherapy point of view, your physiotherapist can help you with pain relieving modalities like very gentle electrotherapy, ultrasound, etc. And obviously, then there are exercises that you can do even when you are in acute pain, because movement does help with pain, contradictory to what we usually think. I have recently written a blog on this. If you wanted, you can check it out. I'll leave the link in the description in the comment below. Also, we work more on long-term rehab. So we're looking at core muscle rehabilitation, basically all gentle work to bring you back to that level where you can then start going into your daily sports or like different activities that you'd like to come back to in the long term. A very vital part of physiotherapy is your lifestyle and postural changes. We'll talk about all this in detail in another live, but this one is just to cover the question. So moving on, another question is, will I need a surgery now that I have a disc issue? Not necessarily. Most of the cases, unless it's very severe, most of the cases will resolve without surgery. However, you do need to dedicate your time and effort into it. So doing all that we addressed earlier. Now, when is a surgery needed? So if you have very severe symptoms or very strong pain, so pain scale of 0 to 10, if 0 is no pain whatsoever and 10 is maximum pain, you can't even breathe without pain, right? So if your pain is more on the higher side, so I would say 6, 7, 8, depending on your pain tolerance, and it's just not going away, right? And you've had an MRI, there's a problem in there. The pain is just not going away. You've done everything you can. It's been 2 months, 3 months. I think it's time to go to a neurosurgeon and get it checked out, and then decide on your pros and cons of surgery, because surgery is also different types. So what exactly does your doctor or your surgeon want to do in terms of surgery? Also, if you have cauda equina syndrome, now, I mean, it's a complicated name, but basically what it means is if you have bladder and bowel issues, that is, if you are unable to control your bladder and bowel, your poo and pee. So that means it is a medical emergency. So you need to go to the hospital as soon as possible. And most probably that would lead to a surgery. So if you remember going back to the previous live where we were talking about the extent of the the disc coming out of the spine. So if you have like a total extrusion where it's completely pressing on the nerves or pressing on the nerves that supply your bladder and bowel, yes, you will need a surgery then. And anyway, your quality of life is going to be not so great. So probably surgery is a better option anyways, right? And anyway, post-surgery, you'll be doing physiotherapy. If you've done everything for 2-3 months, doesn't give you relief, go for a surgery consultation with your doctor. Okay. What else? Oh yeah, another one is, can my disc go back in if I have a bulge? Well, the answer depends on how much of a bulge you have, right? So our bodies are very complicated. They're very delicate, unlike what we treat them as the use and abuse our bodies sort of usage that all of us have, me included, I guess. So our bodies will never go back to 100% once they've had an injury. Maybe 98, 99%, but never 100%. So what we can do is make the best of that 98, 99% potential for recovery. So if you have a bulge, because your disc is swollen and it is just mildly like it's not really hanging out of its place, but it's just mildly swollen, then yes, if there's an inflammation, the anti-inflammatory and probably the steroids or the injections that the doctor will give you will help to settle that swelling. And once that disc shrinks back to its normal size, it'll go back into its place. Yes, that's possible. Sometimes the modalities that physiotherapists use, like ultrasound, electrotherapy, etc., can also help with the same. So it is possible to get back to like a 97-98% recovery with your disc bulge. However, depends on the degree of bulging there is, like prolapse. Yes, another one is, if my doctor told me that my disc bulge is more towards the left side. Okay, just a random example. Or my MRI shows most of my symptoms should be on my left. Why am I feeling them on the right side? Now, this is extremely common, this question. So what happens is our bodies are always working in synchrony with the whole system itself. So it's not like my back will work independent of my neck or the other way around. So, and my left will always work in synchronization with my right and vice versa. So if, say, okay, let's address the muscles and the spine. So say that you have muscles on the left that have gone into a spasm because of whatever is going on. Now, you still have to do your activities of daily living. Like, you still got to brush your teeth. You still got to get up and go to the washroom, even if you're on like a lot of bed rest. So you still need to do a few activities in your daily life. So, and even if you're in bed, you need to turn, twist, right? You're not going to be lying there in one position forever. So in that case, what happens is the back has to move. You have to have a little bit of movement, front, back, etc. So for that, the muscles have to activate. Now, the muscles on the left side cannot activate 100%. So the ones on the right will actually jump in and try and compensate for the lack of movement on the left side. right? So the right muscles over a period of time will be gradually so loaded and overloaded with work that they will also start to go into spasm or start to give in, right? So that is when you'll start to feel the pain on the other normal side as well. Another thing that happens is, for example, if you have, say, a disc prolapse at between your lumbar third and fourth vertebra. So out of the five lumbar vertebrae, say it's L3, 4, right? So what happens is, if it is at L3, 4, there is a stiffness present there because that is like a protective mechanism of the body, right? So L2, 3, so the one above, and L4, 5 is the one below. These two will start to have a little bit more mobility than normal. So these hypermobile segments, uh, above and below, plus the hypomobile segment in between, the one that is affected, these together will sort of disturb the balance in that area. So because of this sudden area of a lot of mobility, then less mobility, and a lot of mobility, so the muscles around there will start to stiffen up, and then this itself, you will start to feel, oh, my pain was actually in the lumbar, why am I feeling it more into, the ones above or the ones below? So this is the reason why it happens, and this is also the reason when you have a long standing low back pain, gradually your thoracic, your cervical, everything starts to get involved, maybe to a lesser extent, but it does start to get involved over a period of time. So yeah, if you're watching me on the live, please comment, say hello so I know you're here. If you're on the replay, please comment #replay so I know you've been here. Um, we address a lot of these questions and topics in my Facebook group. So it's a free group. Please feel free to join. I'll leave a link in the comment below. And yeah, we've been doing quite a few interesting series on there. There are lots of general exercises, advice, tips, and yeah, a good community there if you'd like to join. And yeah, if you have any questions, ask me. I think this was all I had on my list. If you have other queries, feel free to message me or comment here, and we'll take it on from there. Alrighty, you guys take care, and I'll see you next time.